Welcome to the Turd Nerds. We are the functional gastroenterology podcast discussing all things poop. Before we take the plunge into today's episode, let us tell you a bit about ourselves. I'm Dr. Rebecca Sand, a naturopathic physician and acupuncturist, and I specialize in all things gastroenterology, hormones, and fertility.
I'm Dr. Ami Kapadia, and I'm a medical doctor trained in family medicine and functional medicine with a special interest in gastrointestinal health, food and environmental allergies, and autoimmune disease.
And I'm Dr. Ilana Gurevich, a naturopathic physician and acupuncturist who is board certified in naturopathic gastroenterology. I specialize in inflammatory bowel disease, IBS, and other functional digestive disorders. Let's jump into today's episode.
The following discussion is for educational purposes only and not intended to diagnose or treat any diseases or conditions. Please consult your doctor before incorporating any of this information into your care. The information presented on this podcast is not medical advice.
Welcome back, Turd Nerds. Today, our one and only Dr. Ilana Gurevich is going to be leading us in a discussion about enzymes. I'm very excited because I am confused about the differences and when we use them and how much we use them and plant versus animal. So much to talk about today. Take it away.
Okay, so let me give a high profile view, and then we'll kind of chunk it out. So what I'm going to talk about today is I'm going to talk first about the animal-based ones and we'll discuss the pharmaceuticals and the natural options, and then we're going to really break down vegetarian-based enzymes. Okay. Personally, what I have noticed is, let's say I'm in my supplement closet and I'm looking at six
Wait.
Yeah.
What is an enzyme?
Enzyme is something that is used by the body to break down different plant or animal or fiber products.
So it's the ACEs, enzyme and ACE.
Yes.
Okay, and we've got a whole... Are you going to talk about like the different kinds?
Yes.
Like protein.
Yes.
Why I look at supplement bottles and there are like 65 different ACEs on the back.
So here's what I'm going to talk about. I'm going to talk about what all of those ACEs do.
Okay.
Yeah, that's honestly what I want to do.
You've caught my brain up.
Because you're talking about supplement closet as opposed to supplement graveyard, which we
I am betting that there's a lot of these enzymes
in the supplement graveyard because we didn't know which one we were prescribing.
Right, and we don't know what. So here, let me tell you how this all started. This all started because I discovered exocrine pancreas insufficiency, discovered similar to like how MDs discovered probiotics,
right.
So I was like, okay, EPI is a thing. How do I work up and test it? And then I was looking, I'd go back and I'd want to choose a supplement for a patient, right? And I'd be like, what is the difference between this supplement and that supplement? Mm-hmm. And I just didn't understand what each of those enzymes did.
Totally.
So then I did what I always do, which is I got somebody to pay me to actually do a lot of research so I can figure out what all these supplements do.
Particularly the plant-based ones are confusing.
Particularly the plant-based ones are confusing.
Mm-hmm. So is it not just like different types of fiber, protein, and fat?
No, it's even more precise than that. It's different types of fiber or cellulase breakdowns.
Oh.
So different enzymes will target different fiber structures, and it's important to know what you're supplementing with the enzymes.
Yeah.
So, should we dive in?
Yeah. Do you want to... So we talked a little about animal-based ones and EPI, but I feel like that's a little bit easier to understand. Do you want to start there?
Let's even start above there.
Okay.
Let's start about the pancreas.
Okay.
What does the pancreas do? So the pancreas has an endocrine and an exocrine function. The endocrine function is blood sugar, diabetes,
hormones,
insulin, hormones, right? That's 15% of its function.
Wow, I didn't know that. Mm-hmm. Wow, big role for a tiny little part of the pancreas.
15%. The exocrine pancreas is all about digestion. The endocrine secretion is hormonal secretion. It does not go via a duct. It goes through the bloodstream. Mm-hmm. The exocrine portion is duct-based, so it dumps directly into the small intestine, right? Via the pancreatic duct. Mm-hmm. There is a subset of the population that actually has two pancreatic ducts. Whoa. It's a genetic anomaly. It's actually significantly more common than we think.
Wow.
But it's important to look at that because they have less per duct, but they have two ducts to compensate. Wow. So that's not anything about EPI, but
you're just trying to throw us off.
I mean, it's kind of interesting. Like you'll see it a lot on imaging reports.
Wow.
CT scans.
Yeah, CT scans. You'll be like,
they're probably getting the same amount of enzymes. It's just that there's two ducts. So,
exactly.
Yeah.
Yeah.
Wow.
So what do enzymes do? They help break down carbohydrates, proteins, and fats, right? Especially the enzymes that we secrete naturally within our body. Exactly.
That's all we take in.
Yeah.
We don't need air enzymes.
Water.
85% of exocrine pancreas enzymatic function is 85% of pancreatic function is secretion of exocrine pancreas enzymes, right?
Okay.
Those enzymes are lipase, amylase, lipase to break down fats, amylase to break down carbs.
Protease.
No.
Peptidase.
No. Do you guys want to keep going?
No.
So lipase, amylase, elastase, trypsin, and chymotrypsin.
Oh.
Those are the 5 enzymes that are broken down. Lipase for fats, amylase for carbs, trypsin and chymotrypsin for proteins, and elastase is a secondary marker that kind of monitors everything else.
So a majority of the pancreatic function is for enzymes. A minority of it is for hormones as far as structural breakdown. Is that what you were
Like how
saying?
much
15%
of
and
the-
85%?
Yes.
Okay.
Yes. That's correct. So the way this whole process starts is you have food in your stomach churns it up, that it becomes chyme. That chyme will then stimulate cholecystokinin. The cholecystokinin then stimulates the release of the pancreas to start secreting enzymes. So our goal is to have enzymes drop into the small intestine just as the stomach is releasing its first little bolus of chyme or food, and so they're evenly matched. The important thing to know about enzymes functionally is most enzymes are, the way I describe it is they're sitting in a car, right? So they're bound, they're sitting in a car, and they don't actually get out of the car until they're in the small intestine. That is very important, because if enzymes are getting out unbound, they begin breaking down you. And that's what happens with pancreatitis. Right? So that's why it's bad. That's why most enzymes need something to kind of activate it, especially if they're breaking down the trypsin or the chymotrypsin, which are the proteins, because you are protein.
Wow.
So we do not want...
What about breaking down biofilms?
Oh, yeah. Okay, well...
That's a whole
Sorry,
different...
that's a huge tangent.
So,
but I'm just thinking of like when I give enzymes on an empty stomach, and that's
the
when.
enzymes that you're giving on an empty stomach are generally vegetarian-based enzymes.
Ooh, okay.
You are generally
there.
not going to give animal-based
Correct.
enzymes on an empty stomach.
Correct.
Because they will start digesting the only protein that is there, you.
Can you talk
Weird.
a little bit more about pancreatitis and how that's...
Yeah. So basically what happens is if something is wrong with the packaging of that enzyme, so the enzyme is not like metaphorically put into a car and it's going through the duct unpackaged, it will be attacking the duct, the pancreas itself.
Which is why you get severe pain.
Which is why you get severe pain, because you're literally digesting yourself.
Okay.
Wow.
It's awful. And I do think pancreatitis pain is the worst pain out there.
Kidney stone pain, I would argue. I haven't had either, but
Childbirth.
Okay, well, there's that. They've related kidney stone
My
pain to
childbirth.
childbirth. I've had patients tell me the kidney stone pain was worse than childbirth.
Yeah, I've heard
but
that too.
we can agree
It's
to
all
disagree.
I will say, at least my childbirth, I don't remember any of it, because then I get a baby. Yeah, and oxytocin.
Magic.
Yeah.
Can you fit in where in this lineup of things being shot out into the intestines bile falls in?
Yes. So right after the enzymes are secreted, the gallbladder is starting to secrete bile. So they're both pretty much linked. And I do think cholecystokinin actually is the controlling hormone of both of them.
Okay.
But double check me on that.
Okay, so they're both being released sort of at the top of the small intestine as soon as their bolus of food or whatever kind of makes its way in there.
And so just a reminder, the stomach is a really interesting organ because it is both an organ of digestion, but it is also an organ of storage. And so it will be storing the food within the stomach, right?
Yeah.
And so that's important because it's not like you have this huge bolus of food that dumps. It's like you have a drip, drip, drip.
Yeah.
And then if we're talking about the gallbladder and also the liver and the secretion of bile, the gallbladder has the ability to also store the bile and also secrete when necessary, and the liver is a drip, 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 constantly secreting bile.
Yeah.
Which is why I always had a hard time in my head imagining if we're giving someone enzymes, it's in no way going to be nearly as good as the secretion that's sort of endogenously signaled, but obviously it helps because we've had patients with EPI that have significant improvement of symptoms.
Also not EPI. Like, EPI, as we talked about in our earlier episode, is this huge gradient from mild to severe. And there are people who have a relatively mild EPI that also just supporting some...
Can help.
Yep.
Yeah, and interestingly, it has helped patients with pain, which you wouldn't think of. You'd think it would help with digestion, but I remember my last patient giving high-dose pancreatic enzymes actually helped his abdominal pain.
Yes.
Yeah.
So for EPI, elastase is what we use, right?
For EPI, that's a very trick question. For EPI, our
to
laboratory
diagnose.
monitor is using the fecal elastase 1
But
test. Correct.
elastase isn't everything. So you could have decreased pancreatic output and elastase is fine. Is that correct?
Wait, define elastase and everything.
Because I've had people who benefit a ton from animal grade, like pharmaceutical enzymes, but their fecal elastase was fine.
Okay. Right, because there's a definite gradient between mild to moderate to severe insufficiency of the pancreas.
Yeah.
And elastase is a good marker, but it's not the gold standard. The gold standard
everything.
nobody is doing. It's not everything. And I also just want to say, like, the big picture is like, we don't live like humans. You know, we're stressed. We don't slow down to eat. Like, there are all these things we aren't doing.
Right.
And so that's why supporting just the digestive function or the parasympathetic function by something exogenous is so helpful to so many patients.
And I also wonder if that patient, maybe their brush border enzymes aren't doing as well as they could be.
Good point.
So maybe their pancreas is working just fine, but the enzymes still help.
Right.
That is a huge spoiler alert.
Oh, no.
I'm just saying. But honestly, we really start this conversation because of pancreatic insufficiency in one end of the spectrum or another.
So if you want a deeper dive into that, refer to our previous episode on EPI.
We titled it very sneakily, Exocrine Pancreas Insufficiency. I think it was season
More
1.
common than you think.
More common than you think, yep. So when we're talking about using enzymes, our real goal is to provide an activated enzyme into the small intestine during the digestion or prandial period to help the body absorb proteins, fats, and carbs. That's our goal. We have completely equivalent pharmaceutical and natural options when we're talking about the animal-based, pancreolipase drugs.
You said animal and plant-based. Did you mean prescription and over-the-counter?
We have animal-based prescription. 5 different companies are making it. Animal-based over-the-counter supplements. And then we have lots of supplements that are vegetarian-based that are huge variety.
But did you say the animal and plant-based you think are equivalent?
I think that the supplement and the pharmaceuticals are equivalent.
Gotcha. That's what
Of the animal ones.
Of the animal ones.
Yeah.
Yep.
Okay.
I think the supplements and the pharmaceuticals
we're on
are
the same
literally
page.
the same thing. It just really comes down to doses.
And if your insurance is going to pay for it.
Cost, number of pills.
Yeah. I will
Number of
say
pills, yeah.
it is really important. One of the things that happens with patients with EPI in particular is they get a lot of pill fatigue.
Yeah.
And if you take too much, you get side effects like abdominal pain and constipation.
Yeah.
And if you take too little, you have no benefit. So then you're like, why am I doing this? And so being able to dial in the appropriate dose is definitely a thing.
Yeah.
And there's lots of material out there put out by different drug companies that give you guidance on weight, amount of fat in a meal, and dosing. But it is like a guidance. It is by no means a if A, then B.
And I had a patient who did great on the prescription. We couldn't get coverage. Did the over-the-counter, the product with ox bile did not do well. Did the same company without ox bile and is doing better, but not as good as the prescription that we couldn't get covered.
Are we going to touch on ox bile?
I don't know if
We could revisit maybe.
Yeah,
another
I feel
time.
like I have opinions.
Yeah, I do too.
Yeah.
I typically recommend the regular over-the-counter
so do I.
enzyme product now, but sometimes
The drug equivalent.
yeah, the drug equivalent
Yeah.
is kind of what I've moved to.
Yeah. And, the problem, the negative of the OTC enzyme, pancreolipase, really is you don't have as much options with dosing. Like, it's like a standard 2 pills is 17,500 units of lipase. And that might be enough for some people, but it might not be for others.
Yeah, which means you're taking like 4+ pills per
And
meal.
even though we did the equivalent number of pills, we didn't get the same effect as the prescription for who knows why.
Yes. Yep.
I don't know why.
So let's start by talking about animal-based enzymes. They're generally pork-based. That's really important to your population who is Hindu or your population
Jewish.
who is Jewish. They are very, very active in a thin therapeutic window of anywhere from 6.8 to 8. That's important because that window is really, it's made for digestion in the stomach. Like, the animal-based enzymes are there for you to be able to eat and then swallow a pill within a meal, and we're going to talk about dosing them in a minute, eat and swallow a pill within a meal, and then let that pill and the first bolus of food hit your small intestine at exactly the same time.
Gotcha.
That's super important because it only works when the pH of the stomach has been lifted, and when that stomach bolus goes into the small intestine, it also is a higher pH.
So if you take it before your meal, your stomach just degrades it?
Pretty much.
Wow.
It will break it down.
So like have a couple bites then pop it? Is that what you told
So
folks?
ideally, you either take it right at the beginning of the meal,
Yeah.
have a couple of bites, or you take it twice within a meal, where you take it in the beginning and the middle, because then you're catching multiple boluses theoretically at the same time.
So after a couple bites and then maybe again in the middle, not before you start eating.
That's
Right.
labor intensive.
that is labor intensive.
I mean, but if it's helping,
That's true.
yeah.
And I will say that people with moderate to severe EPI,
They're happy
they
to
will
do it.
notice it.
I think it's also easier than having to take something before you eat.
Because then you have to
People
remember.
cannot do
Usually it's
that,
easier to
yeah.
remember, oh, I'm eating. Okay,
Yeah.
I'm going to take my enzymes.
Exactly.
It's a good point.
So these enzymes are functioned or made to function within the small intestine. That's the goal. They hit the top of the duodenum and they start assisting the pancreatic secretion of the lipase, the amylase, and the protease to start breaking them down. If you forget to take them during a meal, then you want to take them immediately after a meal. If it's 30 minutes past, you've missed your window. You literally are meant to dose this around your food so it can act on the duodenum.
So if you do take it after, are you risking degrading your...
It's just a waste of money.
Okay, so they're not powerful enough to actually cause harm.
I mean, that's not true. Based on the data, they absolutely are powerful enough to cause harm. The likelihood of harm is actually quite rare.
You probably have to do it pretty regularly.
Yes. So, for sure. And so, but is there the potential of side effects from these enzymes? Absolutely. Even the OTC ones.
Yeah.
If you're trying to figure out what the side effects are, look at the side effects of the prescription ones.
Yeah, and I had a patient who took it on an empty stomach. I don't remember why, or they didn't realize what all was in there. They picked the wrong supplements.
Yep.
And they emailed me about esophagitis symptoms they were having.
Interesting.
That resolved, but it took
Was
several
that
days
the
to a week.
pharmaceutical?
No, it was just the over the counter, and they picked the wrong pills that they thought they were taking before eating. You know.
Oh, yeah. So what do we know from the pharmaceuticals that cause side effects? It can cause fibrosing of the intestine. That's pretty scary, but that is a side effect known by the pharmaceuticals. It can cause gastritis and like GI discomfort, gas, bloating, diarrhea. That's not uncommon. It can cause abdominal pain. There is this theoretical risk that every drug talks about, which is also a theoretical risk from the supplements because they are animal derived. There is always the risk that you can have some kind of viral infection
Right.
within the animal derived pancreolipase.
Right.
It's never been seen, but every single drug company has to warn us against it. So that's also true for the
What about
supplements.
supplements that have like cow spleen?
That's a risk.
I don't use those.
I don't either, but
But here's the thing.
do they give
That's
you
a
that
risk.
It seems
info?
like a risk.
Yeah.
This is one of the reasons why I feel like our conventional colleagues, especially our very conservative conventional colleagues, struggle with supplements because we don't have the safety assays
Right,
that
for
a
sure.
pharmaceutical company is required to
true.
have.
Yep.
It's
And
true.
I think that a lot of us in the alternative medicine world or functional medicine world assume that the response that the supplements are somewhat safer. And in ways they are, but in ways they aren't. And this is a product that is exactly identical to the pharmaceuticals. Virtually no difference except for the fact that it has less adjunctive agents in it.
And I mean, it is important to say we use physician grade products. So that's one of the reasons we ask people not to just buy any brand, because at least the companies we use, we know do internal testing, even if it's not pharmaceutical grade. Sometimes it is with some of the companies, but it's to a significantly higher standard than the average thing you're going to pick up.
And to not get them off Amazon.
Right, 'cause
because
then
they'll have been denatured in hot
And we don't know
warehouses
how it's
and-
been stored. Right,
Exactly.
exactly. We don't know how it's been stored.
I also, just as an aside, had a patient who ordered something from Amazon
Yeah.
and it was like a grossly different product.
inside the bottle. I've had that
Inside the
happen, too.
bottle.
Yep.
I've only had that happen a couple of times, but I have to say that's a couple more times than I'm comfortable
And
with.
it was
Right.
like resealed.
Yeah.
What
It
is that
looked
about?
Yeah, it looked
Oh.
right. Yeah, that's happened multiple
That's
times.
scary.
That's a
It's-
lot of work for someone to make some money.
Yeah. I mean, that's why I feel like more and more I'm like, can we just buy the stuff that I can guarantee?
Yeah.
Like,
Yeah.
a lot of our companies
So-
do third-party testing.
Yes.
Exactly. Yeah. So back to the question, where was I going with this? You keep going. I'll think of it here in a
Let's
second.
let's start talking drugs. The drug is called
Oh, okay. I remember.
Go.
You reminded me here. So the data on side effects for the pharmaceuticals,
Yes.
is that, because I know most of the pharmaceuticals were developed and are used a lot in cystic fibrosis folks. Is that the patient population?
Not only.
Okay.
So when we're talking about the pharmaceutical based enzymes, there's a huge part of the population that was developed and initially utilized for cystic fibrosis.
Yeah.
But now we're using them for type 1 diabetes, type 2 diabetes, chronic pancreatitis, and a big portion that are people who are using it are post bowel resection, including for obesity.
Wow.
And so we can generally assume, because of the loop of a what's that procedure called?
The Roux-en-Y, the
Yeah.
old one.
Or
I don't know if they still-
even the more common
Yeah,
ones.
I'm not up to date on what they currently recommend.
Bowel
Gastric sleeve.
gastric bypass surgery. A lot of them will have, so I think somewhere between 30 to 90% will have some kind of pancreatic
I
insufficiency.
wonder if they're counseled on that ahead of time.
They need to be.
Yeah.
I think the problem, that population in particular, they need to always be under care because there are so many things that come up post-surgery. And if they're not educated that they need to always be under care, they're going to really...
Nutrient absorption.
Malnourished.
Yeah.
This is totally off topic,
Sorry,
but I
it's
can't
okay.
help myself. So, a statistic from one of the recent conferences we talked about, after hysterectomy, 80% of women will develop prolapse within 20 years.
Wow.
I think I'm remembering that correctly. It sounded much higher than I would have imagined.
Do you know what kind of prolapse?
I'll need to go look at the exact details of. I think it's pretty much sort of like a. I don't want to speak incorrectly, so I should look at the statistics. But it was an astounding number, high percentage after hysterectomy, which is one of the most common surgeries that we perform.
Yeah,
And it also makes sense because now you're missing an organ that's holding
Right.
other things
and
up.
all the
Right.
ligaments connected to it.
And the vagina is basically just a hole.
Yep.
So now you hold up. You take
Anyway,
out
I
the
couldn't help
uterus.
myself. Back to enzymes.
Okay, back to enzymes. Sorry. Okay, so enzymes. Enzymes are always going to be formulated as lipase, protease, and amylase. They will generally be listed in that order, and what we always care about is a lipase. Every enzyme you look at that's a pharmaceutical or a natural will start by telling you your lipase dose, and that is what they base everything else on.
Why?
Because lipase, if you are not absorbing lipase, if you're not absorbing your fats, that is what's going to give you the most risk. If you're not absorbing your fats, you are not absorbing your fat-soluble nutrients. Clinical Pearl, if somebody's having low vitamin D and diarrhea, EPI needs to be on your list because that's an issue.
And bile acid malabsorption.
And bile acid malabsorption, but basically... low vitamin D plus diarrhea, you should circle right back to the GI.
Yeah, but that's also
Unless
like
you're in
half
Oregon
the people in
and
Oregon.
everyone. Depends how far from the equator
I'm
you
not
are,
saying
maybe.
that every single person with low vitamin D and
Don't mix
diarrhea,
it, don't mix it.
but that needs to be in your differential.
Totally.
That makes sense.
Followed by protease, followed by amylase. That is the only thing that is in all of the... That's like the one common for a pancreolipase drug.
Okay.
So when they're giving the dosing of this, I know they'll say like X amount of lipase. Is the ratio to the others always standard?
No,
Okay.
it's not. The one thing that, and even the amount of lipase is not standardized.
Yeah.
And that is actually how some of the drugs, because right now there's 5 drugs.
Yep.
That is actually how the drugs compete with each other because they'll be like, well, we're the one that has this dose or our dose is better. Or you know what I mean? Like, so.
And not just of lipase.
Not just of lipase, of all of them. Yep. And so you need to be looking. And there's, I mean, at this point, 5 drugs, like one of the drugs, Zenpep, which is owned by Nestle, has, I think, 5 or 6 different dose structures, as low as 3,000, as high as 40,000.
Yeah, you've got to read the labels very carefully.
Yeah, totally.
And you also need to try a bunch of doses sometimes.
Yeah.
And the other thing that's important is actually insurance generally covers like a 3,000 equal to how they cover a 40,000. And so, you might need to titrate up and down to find that sweet spot.
Right.
And then you're also looking back at what your patients are telling you they have. Like, is there less fat within the stool? That's a good sign that you're on the right track.
Right.
Are they having abdominal pain? Some people do not tolerate the prescription at all because they don't tolerate the adjunctive agents. Like there's red number 40 and blue number 5, and
geez.
they're enteric-coated, which might be better, or so they say. And so it really is like, this is where like the art of it comes in.
Trial and error.
And are you seeing fat in the stool subjectively or objectively?
Subjectively.
Okay.
These patients will often have very clear steatorrhea, and when you start them on a pancreolipase, that steatorrhea will improve.
Yeah.
Totally.
And
So can you explain to me why I have patients with constipation that get better with animal enzymes?
No. I mean, yeah,
Well, maybe
yes.
it's the brush border again.
Oh, okay. Yeah.
Yeah, I
Could be.
mean, my thought is
Or all the other stuff we're treating. And...
constipation is caused, refer back to our, by the way, guys, the number one episode that we have out that people listen to more than any one of our episodes is the constipation episode.
We're all
There's a lot
backed
of
up.
people are
Yeah.
constipated.
Yeah.
A
all
lot of
backed
people
up.
are constipated, and
Yeah.
constipation,
It's hard to treat.
and it's like
yeah.
multifactorial.
Yeah.
And so part of it might be mild pancreatic insufficiency, and part of it might be stress and a bowel retention and an outlet dysfunction. Like, there's a lot of things that cause
And I
constipation.
have to imagine if there's some kind of pathology going on in the small intestine, any of the ones we've discussed are just dysbiosis or decreased motility, like function is impaired, it's probably going to impact
Yes.
enzyme production or use.
I would agree.
Okay.
I would absolutely agree.
Common sense.
If they're failing therapy, if you start them on one of the drugs and they're failing therapy, play around with the dosing. Play around with making sure they're being compliant with when to take it. That's
Yeah.
a big one. Making sure they're being compliant with when to take them. And also making sure you're giving them the right dose.
Yeah.
Those are the three things that you need to troubleshoot before
I
you give
usually
up.
see it work pretty well.
You said play around with dosing, make sure they're taking it at the right time. And what's the third
Making
one?
sure they're taking enough of it
Okay.
and not too much.
Right.
So, just to give you like a little physiologic overview, on average, per an average fat meal, about 90,000 units of lipase are secreted, right? We don't have any drugs out there that are 90,000. We're not expecting any of our patients to be completely insufficient of their enzymes.
Right.
The degree of insufficiency is varied and gradient based, and so it matters how we're going to dose it.
Right.
And so that's why you really need to play around. Like, this is really a playing around thing.
Yeah.
And there's guidance and there's tables based on weight and fat in the meal. But really, guys, like, I know I've said it before, but it's like a guidance. It's not like a rule.
Right.
So that is animal-based enzymes. Any questions?
I don't think so.
I think that kind of covers it. I guess the way I'm using them in my practice is if I get, an elastase level that's low, of course. But I'll also give them a try in folks that are, maybe trying new foods and need some, like traveling, for example, and need some help digesting, or are just in a bout of bloating, like stuff's off, but I don't know that I necessarily want to do the whole hit it over the head, like long-term treatment,
Right.
antimicrobials, like just as part of a comprehensive plan to kind of get digestion regulated. I will sometimes use animal enzymes in that case.
I do that too, and I think historically that's how we learned about using enzymes, was just part of working on digestion to see if it may be helpful with some combination of what we talked about, even if they don't have
Yep.
pancreatic insufficiency.
Yep, totally. All right, well, let's wrap up part 1 here. Part 2, we're going to get into plant-based enzymes, which I'm excited to hear about because those are the ones that the labels confuse me.
Do you guys want to do a synopsis?
Summary. I think Dr. Sand kind of just did one, right?
Yeah.
I mentioned some things. Anything you want to recap?
I mean, I think my big thing is the pharmaceuticals are equal to the supplements, except for the fact that the pharmaceuticals have adjunctive agents.
Yeah, and red dye 40 is like no joke.
And it's, yeah.
Like, that's worth considering.
Yeah.
But also,
And then also the
4 pills a
phthalates,
meal.
like, a lot of these are packaged to be enteric-coated, so they're not dissolving within
Yeah.
the...
Pros and cons.
Yeah, and so I say, functionally, that's where we're trying to get the enzyme
Yeah.
to be, but also that's chemistry,
Yeah.
and that chemistry is not awesome.
And just informed consent about using it with potential, very low risk, but potential for fibrosis, abdominal pain, gas, bloating, etc., and potential for viruses given it's an animal-derived product, but that hasn't really been seen.
I would say it's all theoretical.
Okay.
But you have to give that warning.
And start your meal before you
And
take
it's
it.
pork-derived for those who don't consume that, to
Totally.
let them know.
Yeah, and make a decision
Not
about their
suitable
health.
for vegans.
Yep, at all. We're going to talk about vegan stuff later.
Yeah. Okay. Stay tuned
All
for
right.
part 2.
Thanks, guys. Thanks for joining us today. Stay tuned. We release episodes every 2 weeks.
If you like this episode, please subscribe and don't forget to rate and review us to help spread the Turd Nerd word.